Hello, everyone, and welcome to Module 17, Understanding Challenging Behaviors. The individuals that you provide care for will be dealing with various stressors. Those stressors could include loss of close friends or spouse, the loss of physical ability, or even the loss of social support. It is essential that the aide learn to identify triggers that result in anger and frustration, as well as methods which to diffuse an angry, combative, or agitated patient. So the objectives are, by the end of this module, the aide will be able to identify key concepts in aging, understand triggers to challenging behaviors, discuss good communication and problem solving, and define the aide's role in working with angry, combative, or agitated patients. So let's learn a little bit more about challenging behaviors. Statistically, Americans are living longer and healthier lives. In 2022, there were approximately 57.8 million people in the United States who were 65 years of age or older. However, living longer is going to mean an increased risk of chronic illness or disability. Tasks such as grocery shopping, cooking, cleaning, housework, self-care, and even walking can become difficult or even impossible to do alone for an aging person or for someone with a disability. So let's learn a little bit more about challenging behaviors. Developmental tasks involve physical and or health issues, retiring and living on a fixed income, the death of a loved one, possibly moving and or making new friends, and one's own life and death. Those are all things that could create a challenging behavior. There can be a great deal of mixed feelings for your patients. Developmental tasks in the older group are adjusting to the physical and health issues. This includes changes in strength, body shape, slower movements, and chronic health conditions that may require medical care or attention. Retiring and learning to live on a fixed income. Also, some people may have identity issues once they retire and leave the workforce. We've talked about adjusting to the death of a loved one. Whether it's a partner or a friend, it's always hard to cope with the death of a long-term friend or companion. Sometimes our patients actually are losing their own children. Possibly moving to an elderly community or facility and making new friends. People may also move in with their adult children, bringing a whole new set of possible issues and adjustments with them. Thinking about one's own life and death. This could be met with fear, excitement, questioning, anxiety, depression, and more. This is a unique experience and feeling that will be different for every patient. So how does the home care aide deal with challenging behaviors? All of these can combine and lead to a great deal of mixed feelings for the patient. Feelings of depression, isolation, anxiety, fear of being left alone can be overwhelming to a patient. This combined with a chronic health issue or disability can lead to the patient exhibiting some challenging behaviors. Also contributing can be memory loss, frustration, chronic pain or body aches, medication side effects. The patient may not mean to exhibit challenging behaviors. They may feel they are justified in their actions given how they feel and what they are going through. Or they may not even have a grasp on how their words and actions are affecting those around them. Working as an aside, there may be times when patients display behaviors you are not exactly expecting. Anxious, worry, tearfulness, irritability, demanding behavior, anger, screaming, agitation. The patient may not mean to, but the aide may have a hard time working around challenging behaviors to do his or her job well and as planned. It is helpful to know when your patient is starting to become agitated. This may help you better prepare with calming them down or alleviating the problem before it gets too out of hand. Signs of things to look for: fidgeting, grinding teeth, furrowing brow, frowning, jaw clenching, eye rolling, hands on hips or being crossed tightly. So let's talk about verbal de-escalation. As a part of communication is something called de-escalation. It is a method of communication used to calm a potentially hostile encounter. Verbally de-escalating a patient can be very hard, especially if there is a health issue or some form of dementia present. It is important to know that reasoning with a person when they are extremely angry or screaming is not going to be effective. Your goal is to stay very calm and collected when talking with your agitated patient. This is hard. It is our instinct to fight back or to flee the situation. However, you must remain calm and always be a professional. While staying calm, you must also exhibit confidence in what you do, saying, and what you are also displaying. Be the authority figure in the situation. Keep your voice low and even. Do not criticize or talk down to your patient. Do not make jokes about their subject or the patient's behavior. This is considered being condescending and will only make the patient feel worse. Remember that your patient may make verbal attacks on you on a personal level. The patient is not trying to hurt your feelings, but instead, he or she is lashing out at you simply because you were there. Do not take this personally and do not react to hurtful comments at this time. This can be discussed later with your supervisor. While talking calmly with your patient, wait for breaks in the conversation to talk. Do not speak over your patient. It is important not to try to win the war. Do not argue with your patient or try to convince them of something. At this moment, it would be pointless. Offer alternatives when appropriate. Try to offer an activity or place where you can feel the patient would be calmer. Allow silence. If the patient stops talking, do not press him or her for more. Let the patient stop and work out their own feelings. If your patient appears to keep coming back to an issue, try to clarify what the exact issue is. Focus on feelings rather than judgments. Here are some of the do's and don'ts. Do: remain calm. Isolate the situation. Enforce limits. Listen. Be aware of nonverbal cues. Be consistent. Don't overreact. Get in a power struggle. Make false promises. Fake attention. Be threatening. Be condescending. Use jargon that the patient may not understand. And very importantly, do not get angry and leave the patient alone. Call your supervisor. So let's do an activity. Have the students get in pairs. The students will take turns giving directives to each other. The student will refuse to do what the other student had asked. Have fun with it. Let them shout at each other. Threaten to call their supervisor. Don't forget about nonverbal communication. Sighs. Roll those eyes. Practice good communication and verbal de-escalation skills. Take turns. How does this make you feel? What felt good? What worked? What felt bad? And what didn't work? Use this as a time for class discussion. So let's talk about physical communication. How your physical presence is interpreted will also make a difference. Try to be at the same eye level and do not turn your back on your patient. Stand a good distance away from your patient and stand at an angle. That way you can step to the side if the patient comes forward. Do not approach your patient or try to touch him or her. Do not stare down your patient. It is okay to look away from your patient's eyes, but be sure to keep some eye contact so that the patient knows that you are listening. So getting to the real reason for the challenging behavior is the key. Is it an attention-seeking method? Is the behavior due to a medication effect or a physical issue? Perhaps the patient is in pain and has yet to verbalize that pain. Instead of lashing out and becoming angry, always report any and all changes in your patient. Did you realize that a simple urinary tract infection can cause a patient to have an altered mental status, or even perhaps a really elevated blood sugar could cause agitation? As the aide, it would be helpful if you could learn to adapt to your patient's emotional needs. Have you noticed that the behavior occurs at a certain time of day or at a certain time of the week? This information is important for the nurse to be aware of. Remember to report any and all of your findings. Learn what sets your patients off and try to work around that issue. Try different approaches and also try to be patient and respectful. Review the plan of care. Talk to the nurse involved about other types of therapy, pet therapy, art therapy, music therapy. Having a soothing activity to be a part of could help the patient with feelings of depression or isolation. Discuss these with your supervisor if you discover your patient has an interesting or an interest in something. Remember that your patient may be talking a lot about other concerns that they have. Maybe they're taking a lot of medications. Medications can react with one another and cause severe and adverse side effects. If we have stressed in other modules, you might be the first person to see the changes in your patient. So it is important to report any changes or problems to your supervisor. So at this time, I'd like for you to have another activity. This is about what makes you angry. Have each student write down one thing that makes him or her very angry. Write down one thing that makes that anger better and one thing that makes it worse. Compare the anger triggers to the better and worse statements. Are there commonalities, differences? Discuss this as a class. Educators, relate this to how things could also be triggers for your patients. Just like anyone else, your patients are going to have good days and bad days. Maintaining your composure and treating your patients with respect, even at the time that it does not feel like they are respecting you, will help to work with a challenging patient. Of course, all occurrences of challenging behaviors should be reported to your nursing supervisor.